So this is Lauren. Lauren came to me and she had these vague symptoms of like neurological symptoms, right? And you feel like fuzziness, sometimes you see the balance is off.
Dizzy, I lean to the left a little bit.
Lean to the left, right? And so my first question to her was, have you seen a neurologist? You know, because we could be dealing with something that is not appropriate here. And she said, yes, I've seen neurologists. Everything's normal. Nobody can figure anything out, right?
Had MRIs done of the brain, all of that. Had the cranial instability looked at.
Right. Now you have Ehlers-Danlos, right? So EDS can cause some issues back here, okay? But what's interesting is I've seen this like 5 times in my career, okay? And so when she lays back, that was her aggravating symptom. So as she goes back, at a certain point, she puts her hand under her head because she starts to get, you said?
Yeah, that little bit, that fuzzy, dizzy feeling.
She gets like dizzy, fuzzy. She's negative for BPPV, so she doesn't have any ear issues. She's been to ENT, she's been to everybody. It's not that. So that would be another, question that I have, is this inner ear issues? But it's not, right? So what I did the other day when I met her was this. So I pushed, come around here. I pushed right on C2 anteriorly, like this. I pushed that way, okay? And I went like this. So we'll bring you back, and I'm pushing on C2. Do you still have the symptoms there?
That's better.
Better? So what I'm doing is I'm mobilizing the C2, and then come back up. I'm mobilizing C2, and then therefore relieving the occlusion of the vertebral artery. It happens with headaches, and it can happen with this. I see it like once every 2 or 3 years. I see this in here, and they're desperate. They don't have anywhere else to go. Nobody knows what's wrong with them, But if you just do that, okay, and push right here, then you relieve it. So what we're doing is I'm working to relax her neck, fix her posture, and then relieve tension in her body with a device that I'm going to give her. And that usually in about 5 to 7 weeks it clears if we can get control of the tension back in here. Okay, so but that's so important that you even check for